Richard Slum was part of an emergency delegation sent to Zimbabwe last December by the medical non-profit organization Physicians for Human Rights. The team investigated the collapse of the Zimbabwean healthcare. This is what Salam saw in a local clinic.
There was no electricity, there's no clean water, and there were no supplies. We did notice a number of boxes of condoms, and that was the one thing that they had well stocked.
At the clinic, Salam met a nurse in charge of the whole hospital who preferred to remain anonymous for fear of reprisal.
We were asking him about supplies, and he said, well, we were asking him about, for example, surgical gloves, protective wear. He said, well, I keep one pair at my house, and he lived at the health clinic, but it was such a prized possession because there were so few that he kept his one pair of latex gloves in his home, which he had to, of course, reuse and wash and try to sanitize, etc. But that gives you an example of how few medical supplies there are in these public clinics. Cholera only comes up, epidemic cholera only arises in outbreaks when there is a collapse of health infrastructure, as what is occurring in Zimbabwe right now. Normally you would see epidemic cholera in war zones or humanitarian disasters or natural disasters, but here we have cholera happening during peacetime in a country that had one of the best healthcare systems not so long ago.